Well, good afternoon, everyone. Today we wanted to provide just a quick briefing on behalf of the City of Richmond, as tomorrow will mark 4 weeks since the city, and also joined by some of our county counterparts, declared a state of emergency here locally. I want to begin by thanking our frontline workers who have been the backbone of our community as we traverse this crisis. Local workers, state workers, those at the federal level as well, first responders, firefighters, police officers, healthcare workers, those who are continuing to work with GRTC, those who are working in grocery stores. All throughout the city, there's a number of workers. I mean, if I stood here today, that were still out there driving our city to where it is today, keeping us going, and I'm grateful for their contributions to the city. As of today, as of this morning, there are 120 confirmed cases of the COVID19 in the city of Richmond, and unfortunately, we've had 6 tragic deaths. Obviously, this disease knows no boundaries. It does not discriminate. So whether by age, gender, or race, this virus knows no boundaries. And we are still on the front end of this as well. As we look at places like New York and others who are starting to plateau, starting to peak, reaching their apex. Here in Richmond, we are still on the front end of the roller coaster. And if you all have been to King's Dominion before, you tick, 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 we are still on the front end of that roller coaster. We have not gone down the hill just yet, and so we still have to be vigilant about social distancing, wearing masks, washing hands, and staying home. As I stated before, we will get through this, but it's going to take a lot of us working together collectively. I want to now hand it over to my friend, Dr. Avula, who's the director of the Richmond and Henrico Health Department. Dr. Avula.
Thank you, Mayor Stoney. I just wanted to kind of give a quick update on where we have been here in Richmond over the last month. As the mayor mentioned, we're 4 weeks into this response. And just a couple thoughts. You heard him announce that we have 120 confirmed deaths. 120 confirmed cases, and then 6 folks who have lost their lives to this. At the state level today, announced over 400 confirmed cases and 100 deaths across the Commonwealth. And I think the clear message to that is that this disease is widespread in almost every part of our community around the state. There have been a lot of questions about when does this get better? Where are we in our peak or in our curve? And I'll just note quickly that some of the projections for when we would actually reach a peak were sometime in mid-May, and those have started to shift, largely because of what has been observed in places like New York City and New Orleans and Chicago, New York in particular, where although they have continued to post record numbers of lives lost, have had now 3 straight days of decreases in new cases confirmed and new hospitalizations. And so that does appear to be that they are over that crest and that they are on the downslope as a city. So, the predictions that a lot of folks are using look at April 20th or so. The Institute of Health Metrics and Evaluation out of the University of Washington is one of those. I'm still cautious about that. I think we may see a little bit of a later curve, and that's really not based on anything but the conversations we've been having with health systems, the fact that our hospitals are relatively empty right now. I mean, the front lines, certainly the emergency rooms, are still seeing high volumes, but there currently does look to be good capacity in hospitals and in intensive care units. And so we'll just need to keep an eye on that data, and the health systems are updating that every day. They're talking to each other on a regular basis. They're making contingency plans for the surge that they expect to come in the next 2 to 3 weeks. As I think about what our work has looked like over the last month, we've had this kind of first phase where we were really trying to understand this disease. We were educating the masses using as much, good information and using the media to target information for different members of our community. We were helping make decisions on large-scale community mitigation strategies like school closures and like the restaurant closures and other things that we've had to do. The health department has been very involved in case contact investigations. So for every confirmed case, our staff is following up with those individuals, determining who else might have had close contact, and then testing concentric rings. And then a lot of our work in recent weeks has focused on long-term care facilities, on our nursing homes, assisted living facilities, both because that's where we've seen clusters of illness and also because that is where the most vulnerable members of our community are currently living. Often elderly folks who have a number of underlying conditions and who are coming into close contact on a daily basis with healthcare workers. We have also engaged in a lot of proactive outreach to these congregate care facilities. In the region throughout Richmond and Henrico, we have almost over 100 of facilities like this, including group homes. And so our teams have been reaching out, providing education, providing a touch point and a connection with the health department in case they have symptomatic cases. And then providing institutional support. We have had our sister agencies across the cities and counties who have been figuring out how do they deal with this in their own among their own employees, and scenario after scenario of do we quarantine, do we isolate, with guidance that has constantly been changing as we learn more about this. So the health department staff has been stretched in every way. We continue to find new ways to build additional capacity. So for example, in the early days of this, when we had 1 or 2 new cases every few days, we could follow up on those case contact investigations. Now we're having 10 or more cases each day, and so we're building our team of folks who can actually do the case contact investigations and work clusters in long-term care facilities. We've gone from a team of 4 epidemiologists, we've added all of our nurses to that staff, and then we've trained our STD disease investigators to add an additional 18 people who can help serve those cluster investigation needs. What are we seeing? I think as we look out in the community, we're seeing that many people are adhering to the stay-at-home orders. Our streets, by and large, are empty, and businesses clearly have had huge decreases in activity. As soon as the guidance changed from the CDC to start wearing masks, we're seeing that mask wearing has become pretty normal pretty quickly. So there's some good news in all of this, and while I expect our peak to still happen, sometime in early May or so, I think that peak will hopefully be lower than previously projected because of the good work that everybody is doing to limit the spread of this disease. Thank you.
Thank you, Dr. Avula. I appreciate that. Thank you for the work over at the health department. Since for the last 4 weeks, we have been finding ways to continue to help those in our community who have been most impacted by this pandemic. A number of restaurants and small businesses have closed their doors, and they were the first that stepped up. We've asked all of our residents to stay home if you can, and so it has totally changed our way of life over the last 4 weeks. But Richmonders have responded, and as Dr. Avula stated, I'm appreciative. I'm grateful for the fact that those Richmonders who can stay home have stayed home and adhered to the protocols and by the CDC and also the health department. Obviously, as was stated earlier, we're going to need more of that as we move forward. For the last 4 weeks as well, I've tasked the city team to continue to find solutions to help whether businesses or families or individuals who are suffering through this crisis on many, many different ways. Some of those ways we've outlined in the past before, but I'm going to quickly summarize some of the work the city has done. The Richmond Economic Development Authority created the Richmond Small Business Disaster Loan Program, which will offer interest-free emergency loans up to $20,000 to small businesses within the city limits. We added $1 million to that fund, and so it will quickly run out, but obviously we want folks to apply. In addition to that, the administration announced last week, in partnership with the Robbins Foundation, Robbins has added $500,000. We've added $500,000 to this as well as a fund to help those families who are facing who are suffering through this crisis as well, in allowing families to apply for $500 grants from that fund. In addition to that, the Finance Department has proposed extending the elderly tax relief program to the end of April, to April 30th. My administration also has worked with Sheriff Irving, also our friends at the Central Virginia Legal Aid Society and other tenant advocates and tenant organizations to ensure evictions are not executed during this state of emergency. I want to give a shout out to our friends at the YMCA of Greater Richmond, who are now operating five emergency child care sites across the city and the region for children ages 5 through 14, for all essential personnel. So those employees who have to still show up at work have a place where their kids can still go during the day, so they can continue to provide services to our city and those who are in need of it. And also last week, we also stood up and launched the RVA Strong website, our rvastrong.org, which will allow for those who are seeking to help Richmonders and those who need the help to go there for a centralized resource hub of different ways that you can provide and receive help in the city of Richmond. One thing I want to highlight as I wrap this briefing up for today is the fact that we have seen some racial disparities in the data that not only here in the Commonwealth of Virginia, but also throughout the country. I stated this via social media either yesterday or a couple days ago about how we're seeing some vast disparities in those who have unfortunately died because of contracting COVID-19 in this country. When you look at some of this alarming data, whether it's in Illinois, Louisiana, or Michigan, Louisiana saw 70% of residents who have died from COVID-19 were black, but black people only made up 33% of Louisiana's population. And we're seeing this same story play out throughout the country. And here's the thing, we've always recognized here in the city of Richmond, that's why the work we did together, Dr. Avula, on the Richard Wood Johnson Foundation's Culture of Health Prize that recognized our work collectively, understanding that Richmond has suffered from generations and generations of injustices on black and brown people, and we still have to continue to dig our ways out of that hole. And those historic policies and injustices, unfortunately, are playing themselves out today through this pandemic. We saw this play out, whether it was the influenza of 1918, H1N1, HIV. Those who are the most vulnerable in our community, those who are black and brown, have unfortunately suffered the most. And unfortunately, COVID-19 is no different. No different. Those who are African American are not more likely to contract this disease, but if they were to contract, because of the underlying conditions in the community, whether they are diabetes, hypertension, you name it, these are the underlying medical conditions that can lead to hospitalization, that someone being on going to intensive care, the ICU, or ending up in a ventilator is because of those underlying conditions. And so we always have known these disparities. It's my hope that we can continue working with our partners at the state level and the federal level to ensuring that the most vulnerable in our community get everything they need to make it through this pandemic. And in addition to that, we're also working with the health department on digging a little bit deeper into some of that data. We know that we've had some large amounts of unreported data when it comes to race in those who've been tested positive for COVID-19, and we want to make sure that we have some accurate data moving forward so we know how we can continue to help those individuals who are suffering from COVID-19, and also for data purposes for the future as well. So, as I wrap this up, and we'll take some questions afterwards, I want all Richmonders to know that this is a marathon. This is not a sprint. We are still in the early parts of this, as Dr. Avula said, looking at a peak in late April or early May. We still have a marathon to run, but knowing the city I know, the city that's resilient, the city that can stand on its 2 feet when knocked down, I know that we will get through this. But we need folks to continue to comply with the CDC orders and the guidelines to continue to wash your hands thoroughly, to wear masks, to social distance, and to stay home if you can. And I focus on stay home if you can because there's still a lot of individuals who have to show up at work. But if you can stay home with your family, please comply with that order. We're begging you to. And with that, we'll take some questions.
Yeah, sure. The question was, after the governor's comments about racial disparities with this illness, and we start actually collecting that data, how will we use that data to differently approach? And so the first answer is that we would, and we've already been doing this, we've already been targeting our communication to vulnerable populations. One of my earliest interviews was actually on KISS FM and Praise FM because we were trying to reach an African American population knowing that underlying conditions would put them at higher risk. The other ways that we the other ways that we might use this are to figure out, what parts of our community are not, is this not penetrating? Where are we still seeing people not adapting these behaviors? I don't think that the racial disparity data around deaths or around cases will necessarily tell us that. We've still got to focus on where those residents of our community live. So I think it'll be more illustrative to us as we start to look at what toll COVID-19 is taking on our community. I don't know that it will change our approach because we already know who's at higher risk. It will probably just confirm some of those front-end assumptions. Across the Commonwealth. So the Virginia Department of Health, he asked if there's any data that's currently being reported. The Virginia Department of Health on their website actually does a racial breakdown daily. The problem is that over 50% of the tests that have been collected, racial information is not provided. So for example, if you were to go to BetterMed and you were to get a test done, more than likely that provider is doing a drive-through test and not actually recording race as one of the fields. So the work to actually go back and find race, we now have committed staff to calling all of our positive cases and asking them what their race is, and then we'll manually enter that into the state database. So there's a lot of front end work that we're going to have to do in a very manual way to ensure that information is captured, and then hopefully moving forward that will just become a part of the standard of how this is reported. So that's not being reported for either deaths or positive cases. We have to go back and collect that information, and I expect for the city we'll have that by the weekend or early next week. So we're doing very limited testing at the health department. Most of the testing that's happening is happening in hospitals or in long-term care facilities or out in urgent care centers and primary care. So it depends on what's the setting. So for a healthcare system, for example, more likely than not, that will be recorded in their medical record. And then our epidemiologists and nurses have to follow up with that medical record, identify the race, and then enter that into the state database.
The question was, what impacts will the pandemic have on the unprecedented investments we had presented earlier a few weeks back now, maybe roughly a month ago, on not only the fiscal year 2021 budget. And Cam, you're right. We are looking at a significant shortfall in terms of our projections, not only for this current fiscal year, but also for fiscal year 2021 as well. And in the budget that we presented, we had major investments in public education, in road repairs and infrastructure. And just like businesses, just like homes, we're going to have to curtail a lot of that back, because there will be a significant loss of revenue, because we've been under a stay-at-home order for the last for at least a week, and we've been social distancing for roughly a month. The approach that we'll take will be responsible, though. We have to take a responsible approach to this. And we have to balance our budget as well. Unlike our friends in the federal government, we have to present a balanced budget to our community and to the city council, and that means that we're going to have to curtail some of those earlier investments. And so I'm asking the community to buckle up, because we're going to have to look at some significant losses. We're talking the tens of millions here in the city of Richmond, and I know the state government's going to have to do the same thing. And if the state government's cutting back, that means that we're cutting back as well here locally too.
When do you intend to introduce the changes to this budget? Will be ahead of the first meeting, or how's that process?
Yeah, you can look for us having a presentation to the city council prepared for Monday. The question was, is there anything that we can do to mitigate the impact in terms of the racial disparities, the impact that COVID could potentially have on black and brown people? First, from day one, I think Dr. Avula can attest to this as well. From day one, our mission has always been that we will do everything we can for our most vulnerable communities. And those most vulnerable communities are our black and brown people who live in the city of Richmond. And so for us, it's working alongside the health department, and how we can see if we can find ways to get more testing out there, so we can understand, we can crystallize the role that COVID-19 is playing in the black and brown community in terms of those who are contracting it. And moving forward, obviously, we have to continue to investing on what I believe are the foundations on building wealth in this community. That is investing more in public education, investing more in housing, investing more in ways that people can get around and be mobile in the city in terms of transportation. These have been our investments over the last 3 years. That will continue to be our mission as well. We all are going to have to take a step back and see what our revenue outlook will look like moving forward. As I stated earlier, as Cam asked the question, we're seeing some significant impacts because of this for fiscal year 2020 and fiscal year 2021. We will obviously present a balanced budget, but we're going to do our best to get through this crisis, and then we can start focusing on the renewal of the city of Richmond. Well, we've already taken measures. You're looking at more general approaches to making sure folks stay at home. Obviously, a lot of our African American and black and brown residents who live in this city, some of them are our frontline employees. They have to show up and work on the front lines, whether it's in the service industry or working in local and state government. Some of them have to show up, but we asked, while showing up for work, that they also adhere and comply with these guidelines. Washing your hands thoroughly, wearing a mask if you can, and also I'm gonna point this out as well. This is the moment in time throughout this pandemic. We're in a crisis right now that everyone needs to practice common sense. Everyone will likely have to wear a mask. And I've seen unfortunate anecdotes throughout this country where when black and brown people wearing masks being stopped by police or others or barred from entry, we all will have to wear a mask. We all should try and wear a mask. And so what I'm asking for is each and every resident, each and every person who works in the city to practice common sense when thinking about that. Because normally we don't see a lot of black and brown people wearing masks, and this is the time more than ever that everyone should be wearing a mask. So everyone needs to practice common sense in this current situation, this current moment that we're in. And so, as I stated, washing your hands, wearing a mask, complying with the stay-at-home order as well. Everyone needs to do this. Everyone needs to do this.
The question is, how many long-term care facilities are currently experiencing COVID-19, and how many are testing all residents and all staff? We're currently working on 12 different clusters in long-term care facilities that have confirmed cases. And I think the decision to test all residents is a really challenging one because, one, our current testing capacity doesn't necessarily allow us to test every resident of every long-term care facility across the region. But two, while it would be helpful to identify positive cases, a negative case leaves you in a quandary about exactly what do you do with that. Do you do you move them to another facility? Do you continue to isolate them? Do you risk the chance that they've been incubating disease at the snapshot in time that you actually tested them, or have had an exposure in that window from the time that you tested to the time that you got a result? I've been sharing over the last few days, what do we do to stop this? What would it take for us to keep this out of long-term care facilities? And I think it's treating every patient like they should be on isolation precautions. And that means that every healthcare worker on every single patient interaction is wearing full PPE. And then that we start to test healthcare workers on a regular rotation, because it's healthcare workers that are going out into the community, that are going to grocery stores, and no matter how safe they're being in terms of staying at home and following the guidelines, with a disease that can be spread before you even know you have it, it is extremely difficult for us to prevent that 100% from coming into facilities. Now, that scenario I just shared is not viable, right? Like, we can't use PPE on every single patient with every single interaction, and we can't test every single healthcare worker on a 3-day cycle. And so we're figuring out how do we approximate that level of control to limit the spread and to limit outbreaks that we're seeing in these long-term care facilities. So we currently have 3 facilities in Richmond that our staff have been working closely with, and that we see some confirmed cases. Here's the challenge, is that by the time that we identify a positive case, we're already, a week and a half behind whatever exposure has taken place, right? Because the time that it takes for the disease to incubate, to show symptoms, and to be tested, and then the lag time on testing, you've already had at least 7 days of potential exposure, and maybe more, given the fact that so much of this disease is spreading before you even have symptoms. So every time we walk into a facility, we feel like we're already days behind. And that it does not mean that there aren't things we can do, but it does mean that there's a certain amount of spread that's going to happen in all of these facilities regardless. So on the front end of this, our efforts were to provide good education, and CMS did a lot of this because many of these facilities are regulated by, or are funded by Medicare, and so the federal agency was providing a lot of guidance in late February, early March around visitation restriction, around screening of staff, and many of our facilities put those precautions into place. So what I think continues to be the case is that as soon as a case is identified, as soon as people have symptoms, they're starting to be isolated, they're starting to cohort staff and make sure the staff aren't cross-covering different parts of a facility. But again, by the time you've got the disease, it's been a few days of exposure. So we'll continue to try to support long-term care facilities however we can. There are conversations happening at the regional and at the state level about what kind of additional supports could be brought to bear care in those settings. Is that the National Guard? Is it military medics? Is it an all-call for nurses, CNAs, and LPNs from different parts of the state who may not be seeing as much disease? And so these requests are being made through our EOC and through our state and federal partners as we speak.
And last question, and just to clarify, because I just saw the push here, extending the city office closures to May 3rd. Is there anything else that needs to be extended that you're looking to?
No, that's correct. We are going to extend the closure of City Hall till May 3rd. There's nothing else on the horizon. We are still going to do everything we can to provide essential services to the city. So whether it's fire, police, sanitation, those operations will continue to be ongoing. Folks can still come in, still request their permitting as well. Those essential operations will continue, but City Hall as a whole will stay closed until May 3rd.
Thanks, guys. Appreciate it.
Thank you, everyone.